Hey there, YouTube, and welcome to Transform. My name is Harmony, and I'm going to be your teacher for the next 3 minutes. So if you haven't done it already, hit that little subscribe button below, and let's get started on the blood flow through the right side of the heart in less than 3 minutes. So we're going to start with this structure up here, which is called the superior vena cava. And down here, we have the inferior vena cava. Both of these structures are large veins that feed de-oxygenated blood into the heart. Veins are just blood vessels that carry blood towards the heart. So that blood goes into the right atrium. In the right atrium, the blood is then squeezed through this valve right here, which is known as the tricuspid valve. And it's known as the tricuspid valve because there's 1, 2, 3 chordae tendinae that keep this valve from prolapsing or collapsing. So the blood then is squeezed through the right atrium, through the tricuspid valve, into the right ventricle. So once the blood's in the right ventricle, it's squeezed again through this valve, which is called the semilunar valve, specifically the pulmonary semilunar valve. So interesting to note, you'll see the word pulmonary. If you know what a pulmonologist is, that's a lung doctor. So that's going to help you out in the idea of what the pulmonary system is. So right ventricle squeezes, pushing blood through the pulmonary semilunar valve into the pulmonary trunk. And then the pulmonary trunk branches off into these 2 arteries. Now, you may be thinking, I thought veins were blue. And yes, typically, veins are blood vessels that carry blood towards the heart, and veins are typically de-oxygenated blood. But in this case, the arteries are full of de-oxygenated blood. So the arteries in the pulmonary circuit are just blood vessels that carry blood away from the heart, but they happen to carry de-oxygenated blood. So these arteries, the pulmonary arteries, are the only arteries in the entire body that are going to be depicted in a blue de-oxygenated color. That being said, these pulmonary arteries, the right pulmonary artery and the left pulmonary artery, respectively, feed the lungs. And the lungs are where this oxygen enters into the blood and creates oxygenated blood from the deoxygenated blood. So in recap, you have the superior vena cava and the inferior vena cava, both of which fill the right atrium. The right atrium squeezes, pushing blood through the tricuspid valve into the right ventricle. The right ventricle squeezes, pushing blood through the pulmonary semilunar valve into the pulmonary trunk. The pulmonary trunk then branches off into the left pulmonary artery and the right pulmonary artery, and both of them feed the lungs. And that is where the second video, the blood flow through the left side of the heart, will be taking off next. Thank you for tuning in. Don't forget to subscribe below.